Artificial disc replacement of the cervical spine basically means we take out a bad disc and replace it with a prosthesis that preserves motion. So what are reasons to do the surgery? If somebody has significant degenerative disc disease, pain from the disc, or pressure on the nerve causing pain, weakness, numbness down their arm, or pressure on their spinal cord, which can cause clumsiness of your fingers or balance disturbance. So after a proper workup, if the pathology is really coming from the disc and can be appropriately removed and replaced with an artificial disc, it's a good surgery, especially for conditions that are not improving with conservative management. So how do we do the surgery? The incision's right by the side of the neck. We don't cut the muscle when we do the surgery. Your sternocleidomastoid muscles here to the side, your throat's right here. We go right in between those two. Your spine is surprisingly close. It's right under your throat. We basically put a metal pin into the vertebra above and below the disc, distract it open, and then under the microscope, we remove the disc and the bone spurs and everything, putting pressure on the nerve and the spinal cord. It's a very safe surgery because we create this empty space, and then all the disc herniation and pathology can fall into the empty space without having to move and manipulate the spinal cord and the nerve, which are behind us. So on a regular cervical spine, the spinal cord and the nerves are back here, the disc is in the front. So if you come in the front, you can remove all the pathology through the very safe approach. There's obviously a risk with any surgery of neurologic injury, weakness, paralysis, numbness. You can have swallowing issues from the surgery, but overall it's a safe, reproducible surgery for those reasons. As far as the surgery itself goes, we take out the pathologic disc, we replace it with an artificial one. There's about 4 different artificial discs approved in America today. They're generally a combination of metal and or plastic. You got to get some fixation into the bone so it doesn't move, but then you also want to preserve motion. The benefit of preserving the motion is it can put less stress on the discs above and below. As compared to a fusion stops the motion, can put more stress on those other levels, can accelerate the normal wear and tear. Artificial disc, by preserving motion, can put less stress and save those other levels from potentially needing surgery for a little bit longer. They're both good reproducible surgeries. With the artificial disc, most people will go home the same day of the surgery. I would say plan on taking 2 weeks off of your life where nothing's expected of you for 2 weeks. Most people are up and walking and moving around right away. People can work from home typically after 3 to 4 days. We don't start physical therapy till generally 4 to 6 weeks after the surgery. We want the neuromuscular control to come back first. Then we start the physical therapy, core stabilization and chest out posture exercises to build the postural muscle support to help take the stress off the neck. Our whole comprehensive program is in the Back Doctor app. As far as results of the surgery go, typically people's pain averages around a 7 out of 10 before the surgery and around a 2 out of 10 after the surgery. So it's a pretty fundamental surgery that can really help people, especially if you have nerve pain and nerve issues down the arm, and the surgery directly takes that pressure off. Other potential downsides to an artificial disc replacement are if you have significant bone spurs, they may not be removed at the time of the surgery if they're behind the vertebral body. And also because it preserves motion, bone spurs can still form at the level of the surgery because the motion allows the bone spurs to form. Whereas a fusion stops the motion, bone spurs typically don't come back. The nice thing about an artificial disc in the neck is if for some reason it fails down the road or has issues, we can typically take it out and replace it with a fusion without a very risky, dangerous surgery. As compared to the lumbar spine, artificial disc replacements, changing those are riskier because of the blood vessels. In the neck, the blood vessels are not in the way, so they can be changed. So we have a good backup plan. In our practice, in this day and age, in 2020, we do about 75% artificial disc and about 25% fusions. They're both good surgeries, both have excellent outcomes overall, both have very similar risk profiles. But because the artificial disc preserves motion, we tend to do that instead of a fusion if it's appropriate for that person's case. If we can help you, please feel free to call us if you want to come see us in person. 310-448-7890, or you can email us at info@watkinsspine.com. Thank you.